Thank you. It's so great to be back here again. Good to see you.
Yes, of course. And it's very important to have you with us because you do represent District 25th, which has Jackson Heights and Elmhurst both in it. So just beginning this interview, I have to ask you, how is the situation in your district right now from the last time we spoke, and are things getting better?
Sure. Well, thank you very much. And you're right. District 25 has one of the largest South Asian and probably the whole metropolitan area. So I'm very proud to be able to represent that community in the city council. But we have had our share of difficulties. And during the pandemic, and we're still in the pandemic, we haven't really fully gotten out of it, although New York seems to be doing better than other places. We had a very difficult time. Elmhurst Hospital is in my district as well. And Elmhurst Hospital was the epicenter of the epicenter. And there was a lot of tragedy and drama going on there, with people bringing their relatives into the hospital, a shortage of PPE equipment for the hospital personnel. It was very difficult. And many people are still suffering the consequences of the pandemic, having lost loved ones. But that being said, we have gotten through what was the worst part, and we're beginning to recover. Certainly, I hope that there is not a second wave of the pandemic. But the big issue, again, in my district remains food. People in my district don't have enough food. So I have been giving food to various organizations in the neighborhood, like the Sherpa Society, like Dromm, Desi's Rising Up and Moving, or NICE, New Immigrant Community Empowerment, to Adhikar as well. And we've managed to give out weekly deliveries with the Sherpa Society. Wow. So food remains a big issue. A lot of the South Asian immigrants who live in my district drive cabs. And as you know, people are not in the city. They're not able to really work. So it's been difficult for those cab drivers. And the economy has been slow to come back. We recently opened a new open restaurant street on 37th Road, right off of 74th Street in Jackson Heights, near Diversity Plaza. And I think that's helped some of the local businesses a little bit because they can do outdoor dining now. I know the neighborhood is excited about it. But we have a long way to go. We have a long way to go until we're back to where we were pre-COVID, say back in February or so.
Definitely. And you just mentioned food insecurity, council member. How much of that insecurity of food is connected to the racial disparity that has been seen throughout the healthcare system with COVID-19?
It's very much connected. And most of these folks are people who are working, but are working in jobs that prior to COVID were not considered essential. But certainly we've learned how essential they really are. I mean, the drivers, the healthcare workers, the food delivery people, but these are all lower income people who have many health disparities, who have not had access to quality health care. Even with Elmhurst Hospital being in the district, it's still very difficult for them to get adequate health care. Many of them do not have insurance. Many are undocumented. And so very little alternative is available to them. And the only place that they can go is to Elmhurst Hospital. They're not getting the primary care that they need, which would be preventative type medicine. So those disparities, unfortunately, exist. It's probably been highlighted more due to the pandemic, but certainly they were there before and they're still there now. That is a long-term situation and one that we need to continually address to make sure that those inequities eventually are addressed.
Currently, do you have enough PPE, beds, ventilator, and any kind of necessary material that is needed and equipment that is needed for these hospitals? I know there was a huge lack of it when the epicenter was New York City, but in case there is a second surge, are you prepared?
Well, I believe that we are. I've spoken with the executive director of Elmhurst Hospital, Israel Roca, and he says that they are prepared, that they have enough equipment. And so, I trust him and believe that we are. There are some nursing homes in the district that I also had to secure PPE for. And since I've spoken to them, they have taken, the issue and seem to also be prepared. So hopefully we are ready. When this happened, I don't think we were at all ready. But we've learned, hopefully, that we need to stockpile this PPE so that in the event in the future, we do have that second or maybe even a third wave. Broadway is not scheduled to open, I don't believe, until next April. Wow. And so if we're not going to open Broadway till April, that means people are thinking we may possibly have a second and or a third wave of the virus. So we need to be prepared for it. And I believe that we are, at least in the surrounding district, as best as we can be at this point.
This brings me to a really important question that is concerning everybody, which is the economy. According to you right now, what needs to be the focus for economy and reopening? And when you're looking at an area like Elmhurst, how cautious do you have to be about this reopening?
Yes, we have to be very, very cautious, and we have to keep people's health and safety first and foremost. I really would like to see our restaurants begin to open for indoor dining. However, there is tremendous concern that with indoor dining, the spread of the virus could go more rapidly. So I know that there were council members today who were pushing the governor to reopen some of these businesses. For example, out in Eastern Queens, people can go to restaurants in Nassau County, which is 15 minutes over the line, over the border, and they can do indoor dining. So the business owners who have restaurants in Eastern Queens can't open yet, so they're losing all of that business. So I see a need to, support our small businesses, our restaurants in particular, so that they can also recover from the pandemic.
Council member, I have to ask you, when we're looking at these economic and healthcare ramifications of COVID-19, what is truly needed to sort of lift us out of this impact? In terms of money, how much money is needed in your district, or what are the resources that you're lacking right now that we definitely need?
So I'm the chair of the Finance Committee of the New York City Council, and we had to pass a very difficult budget this past June, which cut the budget by about $7 billion. The mayor was originally proposing a $95.5 billion budget, and we brought it down to about $88 billion. That's bigger than some countries' budgets, believe it or not. But that $7 billion cut meant that some services to folks had to also be cut, particularly social services and things like that. And we had to make those cuts, and we could have to make even more cuts if we don't get federal aid. The city has only received $1.3 billion in federal aid so far, but we need about $9 or $10 billion or even more than that to get ourselves back on our feet and to avoid layoffs. The mayor is now talking about laying off 22,000 workers. Wow. That would possibly include many traffic agents who have, within those traffic agents, there's a large South Asian community of workers. And usually the way union contracts read is the last people in are the first people out. Yeah. So I think that if we don't get that federal aid and we have to have layoffs, the South Asian community in particular would be very hard hit. So we need to avoid that. We need to keep pushing Washington. We need to keep pushing Senator Schumer and Senator Gillibrand to ensure that we get that money. It's the United States Senate that is holding this up. The Congress has already passed a plan, but the Senate has not, and we need to fight for those dollars.
I have to ask you here, are you happy with how the local and state governments of New York as a state has handled COVID-19? Are you particularly happy with the mayor and the governor?
Let me just address the governor first. There is a adult day center in Elmhurst, which is also kind of a nursing home. It's really actually both. And we were calling attention to the large increase of COVID within those types of institutions. And we got very little help from the state. I just don't understand what was going on. But, the governor was placing elderly people taking them out of hospitals and placing them into nursing homes, knowing that they had COVID. And those elderly patients are the most vulnerable. And not only the patients who were coming in, but the patients who were already living there. So I'm critical of the governor on the nursing home issue. And we really need to address that so that does not happen again in the future. There does seem to be some progress there, but not enough in my opinion. And then in terms of the mayor, we were getting very mixed messages in the beginning. I think now it is more cohesive, and the mayor has been holding daily news conferences since the start of the pandemic. But getting information out to New Yorkers is really important. And opening the restaurants, I think, as soon as possible is also something that's important. We just had the issue of the school openings.
Right.
Today, they announced an agreement with the United Federation of Teachers that they're going to delay the school opening from September 10th until September 21st. So that was quite controversial in the beginning. The mayor was not giving in. He wanted to keep the school opening on September 10th, but the union, United Federation of Teachers, and other unions, the principals union as well, was saying, no, we need extra time. So this seems to be somewhat of a compromise, but it's really important. Children are now probably one of the top spreaders of COVID. Right. And so children gathering in schools can be a dangerous situation. We need to ensure that their schools are safe and secure and that people will be healthy in those buildings.
Council member, a lot of parents are watching you right now on ITV Gold. They're so concerned about their students going back to school. They're still not sure if a hybrid learning is going to be good for them or if they should only stay on virtual. What is your recommendation or advice to them?
That's a really hard question, to be honest with you. I think for a lot of our parents, particularly the parents in my district, and for many of our South Asian parents in particular, they've got to get back to work. And so they desperately need the services of school, even if it's 1 or 2 days a week where they have in-person learning, or they can't go back to work. So even if they get a break 1 or 2 days a week and they know that they're going to be going to school, at least then the parents don't have to pay for a babysitter or rely on a neighbor to take care of their children. At the same time, our parents are nervous that our children would get sick. So that's a real dilemma. I'm not a parent and I don't know what decision I would make. I tend to think I would probably go with the virtual learning, with the remote learning, 100%. I don't know. Everybody has to make their own decision on this, considering their circumstances, but a very difficult decision to make.
Definitely, and we have to keep the students safe somehow. Given universities across the country are right now reporting COVID-19 cases. We've even heard of many schools shutting down. We're just hoping the best here for New York. I want to now take this conversation and really discuss something that's impacting the nation a lot right now. This race war that we're seeing, the racial tension we're seeing since the case of Jacob Blake and also since the death of George Floyd. My question to you is, what are your comments on what's happening right now? And there is a nationwide debate on police brutality and police defunding. What are your comments?
Sure. So, the whole situation, I think, is a very sad situation. I'm a child of the 1960s, and I remember Dr. Martin Luther King and seeing him on television and fighting for basic civil rights, the rights to employment, the rights to housing, the right to vote. Which were really hard fought for in the 1960s. And here we are, 60 years later, and we're still facing many of the same issues. And it's not just African Americans, it's any person of color in this country faces this type of discrimination. So my heart goes out to them because they're being judged solely by the color of their skin and not by the content or the character or their character. And so the struggle continues. a lot of it has been centered around police brutality, and in particular for those two cases, where the police officer shot the man in the back 7 times with his back to the police officer. Now, in my opinion, there is no excuse for shooting someone in the back. If they have a gun and they shoot at you, or they in some way have a life-threatening situation, I could possibly see the use of violence. But there were so many other options in that case, and the same thing with in Minneapolis and Minnesota, where the police put their knee on George Floyd's neck for such a long period of time. 9 minutes, I believe, is the total amount of time. How could somebody do that? I just don't understand the inhumanity of doing that to someone, and killing them, essentially. So we need to educate people. We need people to know more about what this type of prejudice and discrimination means in the lives of people of color in this country, and what type of a detrimental effect it has on our country. This is not what America was meant to be.
Yes, for sure. And what do you think could be a solution to these issues?
Well, I have always been a big proponent of education. And one of the things that the chancellor has been trying to do, and has been fairly successful at, is in teaching implicit bias and race relations in the public school. Of course, he's been getting a lot of pushback on that from the very people who you would expect him to get the pushback from. But I believe that recognizing our own internal prejudices, I have them, other people have them, we need to recognize them first so that we can overcome them. And even good-minded, good-willed people hold certain prejudices against different groups of people. Oh, they did this because they're that way, or they did this. We all have that. We need to unlearn those things. And we need to teach children at a young age that the differences are what make our world so wonderful. It's one of the things that makes Jackson Heights the best place in the world to live. I have to say that because that's my district. Yeah. But I believe it very, very much. There in Jackson Heights, people who don't get along, even in their own home countries, learn to get along with each other because we're all in the same boat. And I think when we can teach that to the rest of the world, finally we'll have some peace in the world.
Yeah, definitely. Council member, a lot of youth is watching you right now on ITV Gold. They're seeing everything unfold in front of their eyes on television, on social media. Everything has gone viral. What's the key advice you could give to them in terms of, truly connecting with their own identity and not being scared?
I was a child of the 60s, as I said before, and America was a country in peril back then. We had the Vietnam War going on. We had Robert Kennedy's assassination. We had Martin Luther King's assassination. Those were very frightening times. I was almost drafted into the Vietnam War. And so we did get through that. We got through that because we raised our voices and we said no more to the Vietnam War. We said we want accountability in government. And of course, nothing ever turns out perfect, but we were heard. So my advice to young people is to get involved and let people know what your ideas and thoughts are. Yeah, Twitter is great and Facebook is okay, but get out there and work with other people in groups. Get out and demonstrate. Let people know how you're feeling. Become visible. We need people to see who we are as communities, as different communities, but also as a community. And that's my advice to young people. Get involved. Make sure as soon as you turn 18, you are registered to vote and vote.
Yeah. And you just hit on voting, and I have to ask you, we have presidential elections coming up in November. It's a really big race that has a lot of debates going on nationwide. According to you, especially addressing the South Asian American community, what kind of issues should we be looking at? And when we're looking at the importance of voting, how essential do you think it is right now for this year?
So we have a wonderful candidate. I am a Democrat in Kamala Harris. And, she's part African or Jamaican. Her father was Jamaican and her mother was Indian. And so that's something for South Asian people to take pride in. And we've seen a number of South Asian people getting elected in the borough of Queens as well. And so people, and particularly the South Asian community, has been very smart about becoming politically active. And so I think that's how we create change. So with our South Asian community, stay actively involved in politics. And that's another way that I think that we can create the change that we need in this country. As a Democrat, I am a supporter of Joe Biden and Kamala Harris because I believe that they can set a tone in America which President Trump has not set. I find President Trump to be divisive and to be pitting one group against the other. He tries to say that he's not responsible for the violence in this country at this point, for the race relations. But if he's not responsible, who is? He's the president. Joe Biden is not the president. So he needs to take responsibility for his actions. But I think it's beyond that. And I think we need to get behind Joe Biden and vote for Joe Biden.
I have to ask you at this, do you think this administration under President Trump has handled coronavirus and other relations this year properly?
Oh, no, absolutely not. I mean, the lack of PPE goes right back to the delay in the White House. And it has been unfair and it has been inequitable. The White House, the president, was giving PPE equipment to other states other than New York because we have New York elected officials. We have Democratic elected officials in New York. So he was picking and choosing who he wanted to give that equipment to.
For sure. One more question on the elections I have to ask you. The conventions just happened. What did you think about both of them?
So I thought that the Democratic convention had a very good message, a message that was saying we're going to unite America. We're going to bring America together. They, spoke about the pandemic and about the need to provide all Americans with health care. I found the Republican convention to be just the opposite. I found it to be very divisive and to be pitting one group of people against the other. And also not to be true. Rudy Giuliani, the former mayor of the city of New York, got up there and said that we have more crime now than under him, which is just simply not true. There were more murders under Giuliani than there have been under Mayor de Blasio, and almost double. Plus, Rudy Giuliani had a corrupt police commissioner. So I don't know what Rudy Giuliani is talking about, but a lot of misinformation, a lot of propaganda was spread during the Republican convention, and people need to realize and become educated about what the truth really is.
What are your hopes for the rest of 2020, Council Member?
Oh, that's a really hard question too. I was in Times Square this year when the ball dropped for 2020, and I said, I just hope it's a great year. And of course, we only got 2.5 months into the year when we began to hear more and more about COVID. And, I just couldn't believe it. So my hopes for 2021 is that we have a vaccine and that our country can become united and that we can move forward in a direction that's beneficial to all Americans, to all New Yorkers. And so that's really my hope right now, is for everyone's health and happiness and that we stay together supporting each other as different communities within a community.
Well, thank you so much for your time here with us on ITV Gold, Councilmember Dromm. I would love for you to give one last message to our audience.
Sure. So the message is stay strong, stay healthy, wear a mask, and socially distance. That's what we have to do to get through this, and I think we're going to turn out okay. Remain hopeful. Thank you.
Of course, the hope should not go away. Thank you so much again for your time.